I'm Simone Absalom Gale. This week, our focus is your health and insurance. Non-communicable diseases are the leading cause of death throughout the Americas, but the epidemic has hit the Caribbean region particularly hard. NCDs represent not only the major causes of death, heart disease, cancer, stroke, and diabetes, but are responsible for the greatest share of the burden of disease in the Caribbean region, 65%. Jamaica is no exception. NCDs have spread progressively among the entire population in the last decade and are the leading cause of mortality and morbidity, accounting for the largest number of hospital discharges. But how did we get here? How do we move from prescription to prevention? If you already have an NCD, what are the best options? Where does insurance fit in all of this? Joining us to discuss the issue is Dr. Suzanne Soares-Winter. She's a director at the Heart Foundation of Jamaica, a clinical nutritionist at Caribbean Institute for Health Research, and she's a lecturer and the course coordinator for human nutrition at the Faculty of Medical Sciences undergraduate medical degree program at the University of the West Indies. Of course, we also have Dr. Natalie Walters. She is a financial advisor at Sagicor Life Jamaica Limited. She's a general practitioner and a graduate from the University of the West Indies. Thank you so much for agreeing to speak with us, ladies.
Yeah, all right. Thank you for having us.
All right, we're going to start with Dr. Soares-Winter. How did we get here with the current level of NCDs?
Well, as the numbers that you've just mentioned, it shows the frightening prospects that we have, where cardiovascular disease is one of the main factors why our high morbidity and mortality rates are as they are. And unfortunately, as Jamaicans, how we've been eating and our lifestyle behaviors have been key risk factors for that situation. So there was a survey, the lifestyle survey done in 2016, 2017, which was the most recent one. And those show that, the risk factors that we have in terms of our diet. So maybe 1 in 3 persons were having sugary drinks per day. And as you know, many of our sugary drinks are very high in sugar, and sugar does have an impact on your heart health. Approximately 8% were consuming fast foods daily, and this includes ultra-processed foods, which are classically very high in salts, sugars, and fats, and especially the unhealthy fats. Even our eating behaviors are unusual in that many of us, 1 in 10 of us, uses too much salt, whether in terms of just adding salt at the table, using high salt seasonings, and the ultra-processed foods. And since we're speaking about heart health, we must look at other aspects of our diet. So, 41% of persons drink alcohol, or, nearly 10% or 15% of us smoke tobacco. And even though this is not related to diet, but we are actually quite inactive as a group in that mainly 80% of Jamaicans are very low in activity. So all of these are major risk factors for why we see those numbers.
All right, we want to bring it into insurance. Natalie, how does insurance get into this?
Into all of this. Okay, so Dr. Winter was speaking about lifestyle modification and the fact that in terms of our diet and exercise. So at the end of the day, what we have to also look at is if you are already on the path to having one of these issues, then what can you do to help to support yourself? Dealing with these conditions cost money, and that's where insurance comes into play. So you'd be talking about having health insurance to deal with the general expenses associated with dealing with health, as well as having critical illness insurance, which now is going to be able to take care of the additional expenses that can come with a critical illness, such as a heart attack or a stroke, which can happen when you have things like diabetes and hypertension.
All right. Dr. Winter, since the pandemic, though, have we seen an increase in the number of NCDs being reported?
Well, I know, for instance, at the Heart Foundation, we have seen an alarming number of persons who come in and were not even aware that they were hypertensive. So the fact is that many persons aren't even aware that their blood pressure has gone up, and it's not just undiagnosed, it's not being treated appropriately. A recent study coming out of UTech, the University of Technology, which I think just came out in January here, showed that 80% of Jamaicans have actually reported a gain in weight, in body weight, just since the pandemic. And so even though we have those figures, it's very clear that body weight or heart health, and even just our lifestyle changes that have resulted as a result of the pandemic. So lack of movement, we've had disruptions in our just day-to-day activities and or eating patterns. And we suspect that, there has been a drastic improvement in these figures, which were already very bad from the get-go.
Really, really, really important data that you've brought before us, Doc. But before we continue with the conversation, we're going to take a short break. When we get back, we're going to delve more into heart disease and its significance in the Jamaican society. And when do you really need to get insurance? Stay with us. PBCJ Presents. We'll be right back.
This is what you've been waiting for. A chance to change your point of view and take the break you deserve at Jamaica's resorts and attractions. When you can open your door to the seaside instead of just outside. Where you can change your mask and take a plunge.
Sunshine smiling warm up inside your heart. Feeling of pure love. Oh, Jamaican heartbeat. Dancing to the beat. Up inside your heart. Whoa. Heartbeat of the world. Oh, Jamaican heartbeat.
Contact your travel agent today to book your staycation. RediscoverJamaica.com.
Jamaica Eye can help you protect our citizens.
Jamaica Eye will play a part in increasing your public safety.
Jamaica Eye is part of an island-wide network of camera surveillance systems designed to increase the safety of you, our citizens. If you have a camera system outside your home or office facing a public space, log on to jamaicaeye.gov.jm today. Jamaica Eye, we're all connected. The Ministry of National Security, creating a safer and prosperous Jamaica.
Welcome back to PBCJ Presents. In this episode, we're looking at your health and insurance. Now, let's zero in on heart health. Why is it so important to maintain a healthy heart in the Jamaican experience? Dr. Soares-Winters.
Well, as you can imagine, having a healthy heart is essential to the proper functioning of just every system in your body. Our life depends on that, having a healthy heart. And if you remember, based on the results that you've just spoken about, cardiovascular disease does contribute to heart disease and stroke, which are leading causes of death. And with it accounting for 30% of deaths among Jamaicans. And we need to recognize that this is no longer just about the elderly, a disease of the elderly, which is what it was maybe a few decades ago. We know that more women are at risk. We also know that a large proportion of our children are also hypertensive. So there was a study in 2017 that showed that nearly 30% of children between 10 and 19 years old were already hypertensive. And that's quite alarming when you think that these are children who are now shaping up to become adults with long-term illness that will affect them. And so maintaining a healthy heart is something that's we have to look at it as an entire whole of population approach.
It's interesting that you bring about the point that it's now affecting the younger members of society. Dr. Waters and I were speaking off camera about when you should get insurance, because now a lot of people would probably want to wait a while, but you have to start young.
Yes,
Talk to me about that. And you were telling me an instance. You were telling me about an instance with a young client of yours who had a stroke early in life, so, as we would say in Jamaica.
Yes.
So when should we get insurance?
Right. So what a lot of Jamaicans don't understand is insurance is bought with age and good health. You just use money to pay for it. So what ends up happening is you really should try to get insurance and get a policy. It's not just about having insurance. It's what do you have, what does the policy cover, and how much do you have, right? And you're really trying to get it at a time when your age is low and your health is good. So that's a young person. And with, as Dr. Suarez Winter was saying, with the new onset of all these lifestyle changes or lack thereof, what's happening is that we're having issues with obesity and persons developing hypertension at a younger stage. And just as how in the medical field we recognize that it's causing a problem, in the insurance industry they know as well. And so somebody who comes to us who is young, but they have a strong family history of hypertension and diabetes. You know, they have a close family member, whether it be a mother, father, or a sibling, who has had these issues and may have had a stroke or a heart attack early. They're looked at differently just based on their family history alone. When you now tie in your own medical history, how heavy are you in comparison to your height? So what's your weight for height ratio? They also are going to look at your own levels of blood, your blood pressure levels, so to speak, and therefore they will be able to make an adjustment in terms of what your premiums are going to be, and therefore how much money you are going to be asked to pay for a certain coverage. The factor that you can adjust there is buying it early and taking care of your body, your physical health. You may not be able to change your family medical history, but you definitely can do something about your own medical history.
You were telling me about a client who came to you to insure his mom.
Yeah, well, he came because he wanted insurance just to protect his mother. So insurance is really, it's love money as well as it's income protection. Right, so it's protecting your income in the cases of critical illness coverage, and it's also protecting your family income. And so he wanted to get some family income protection, so that if something would happen to him, he would be able to provide. And I remember I was working in the emergency room for a few years, and so there are some things you develop. And I remember asking him, he said to me that he was a diabetic, which would change in terms of what I would be able to offer him from my company. And I remember saying to him, what do you know about your diabetes? You know, what was your last result? What was your HbA1c result, which is your levels of sugar basically for the last it looks at your levels of sugar in your blood for the last 3 months. And he didn't know. So as a physician, I thought to myself, you know, this probably is not a diabetic who is taking care of himself. And I suggested to him that perhaps he should try to have some critical illness coverage because he was in his 30s. It would have been worth it. And, you know, it's unfortunate, but just a few years later, before he even hit 40, he was diagnosed with a stroke. And, you know, his job, when you look at your income and what he got paid out from his critical illness policy, that was what was able to maintain the family while he took no paid leave from work and provide that income that would not have been there to take care of the additional expenses that you have to deal with when you have a critical illness.
Interesting point right there, Dr. Waters. We're going to take a short break. When we get back, we're going to be hearing more about the activities of the Heart Foundation, and we're going to be learning about the type of insurance we should get based on where we are in life. Stay with us. PBCJ Presents. We'll be right back.
Give yourself a fighting chance. Wear an approved helmet. A message from the Road Safety Unit in the Ministry of Transport and Mining.
Welcome back to PBCJ Presents. We're talking about your health and insurance. We have with us a director from the Heart Foundation of Jamaica, Dr. Suzanne Soares-Winters. Now, Dr. Winters, I want to learn about the experience at the HFJ in terms of persons coming in with these illnesses. Tell me about the numbers.
Okay, so as you know, at the Heart Foundation, we offer quite a number of general screenings for blood pressure checks, ECGs, coming and checking your cholesterol. And what we've found over the past year, we've screened maybe close to 4,500 persons coming in, just persons coming in. And what we realized was 31% of those persons had high risk blood pressure, meaning they weren't necessarily hypertensive, but it was high enough to put them at risk of becoming hypertensive. And more than half, so 52% of persons recorded a high blood pressure measurement. And unfortunately, a large percentage of those persons were not even aware that they had high blood pressure. And that's really the frightening aspect of it, in that there are persons walking around who don't even recognize that they have high blood pressure. So, you know, you don't necessarily want to reach this stage where you need critical care insurance. That's what we're trying to prevent. What you really want to do is make sure you get screened. Just get to know your numbers, get to understand your nutritional status, see what your body mass index is. Is your weight healthy for your body height? And what is your blood pressure? Are you at risk of high blood pressure, diabetes, high cholesterol, and any of those risk factors that would put you at risk of heart health, poor heart health?
It's interesting that you said your weight is something that you really need to look at. This year, the Heart Foundation is focusing on the way to a healthy heart. Share with us the reasoning behind this theme. You mentioned a little bit of it, and some of the activities that you'll be embarking for the rest of the year in terms of getting the public more aware of this issue.
Well, we were very strategic in coming up with that theme. So based on many of our pre-existing conditions, we already know the very high prevalence of obesity and overweight among both adults and children, that most of us would benefit from some amount of weight loss. And even 10% of weight loss shows remarkable benefits on your heart health, your cardiovascular health. So we are emphasizing persons to be aware of your body mass index, which is your weight in kilograms divided by your height in meters squared. And yes, we want to emphasize that not everyone will reach to the ideal BMI, which is 25. And yes, there are many of us who can actually be healthy even at a heavier weight. But the evidence is very clear that a high body weight does impact your risk of heart disease. And so at Heart Foundation, because body weight is such a leading risk factor for poor heart health, we are focusing on just increasing public awareness of all the factors that contribute to us gaining weight, our unhealthy diet, trying to encourage persons to become more active, and just knowing what your numbers are. So get your blood pressure checked. Get your diabetes checked, look and see what your blood sugar, your blood cholesterol is. Even come in and do an ECG check. And these are services that we do offer at the Heart Foundation for the general public, so you can come in without a referral. If there is a problem, so when you come in, if we recognize that you do need a referral, we do have cardiologists there, we have nutritionists there that can run through your diet. We have general practitioners there who can help to assess you in a general way in terms of what the relationships are with your lifestyle and make whatever necessary referrals.
Dr. Walters, you have been in a situation where you're in the public sector, in the hospital. Tell me a little bit about that experience. Dr. Soares-Winters, she's given us the data, and she's given us the experience of the Heart Foundation, but you have been in several hospitals. What did you see?
All right. So I believe one of the probably the most disheartening things is the fact that you will have a full hospital ward with patients that don't need to be there. Because if it is that you can start to take care, as Dr. Soares Winter is suggesting, you start to monitor your weight, start to monitor your blood pressure at home, monitor your diabetes if you're already diagnosed, or have regular general practitioner visits. So we grew up in a society where a family doctor was a thing. I currently now always hear so many of my clients say, oh, I haven't been to the doctor in so long. How will you know what your current blood pressure or what your blood pressure for the last few months have been? By the time you start to have symptoms of some of these non-communicable diseases, it's already too late. The body is amazing. It does a lot to compensate for what it doesn't have. And so what will end up happening is you end up being somebody on my ward with a stroke or a heart attack because you had an undiagnosed issue. So your blood pressure was high for years. You would get a headache intermittently thinking, oh, it's nothing. You just drink some tea and have some sleep and go back to bed. And what ends up happening is you really had undiagnosed high blood pressure for years, which was damaging the blood vessels to your brain, and that's how come you've now had a stroke. Or in another situation, it damaged the blood vessels to your heart, and that's why you're presenting now with a heart attack. And it's just, that's a problem because it means it overburdens the public healthcare system with things that are preventable.
How do you get men to come in? Because in our society, men generally, they don't go unless
there's a problem.
There's a problem. So, and meaning a major problem. They'll get a headache and then just not go. They don't want to do screening. They think screening is invasive. I'm sure Dr. Soares Winters has that experience as well at HFJ where they're just not.
They're not interested.
How do you?
What I have done, in my instance, if I have clients, or even before when I had a patient who was a man, I would encourage the spouse. So, you know, the girlfriend, the wife, right? If they have children who are old enough to understand, to take them along. So get involved in the life of the man who is in your life and encourage them. Take them along with you for a visit. It doesn't have to be long, nothing has to be wrong, but at least once per year. And of course, the older you get, and you know, if anything is diagnosed, then you'd have to go maybe 2 to 3 times per year, depending on what's happening with you. But just getting that screening and just being able to pick up certain disease processes that have started at the earlier stage, where we can manage them at a general practitioner level, meaning your GP, your family doctor, or even in the at the healthcare facilities. You know, so going to your health centers, and where the treatment can start there in terms of whether you just need to be advised on diet and exercise changes, or if you need to be started on 1 medication or 2 before you have to come to the hospital for an actual critical event.
Sagicor is one of the largest insurance company in the Caribbean. In terms of claim, how much money in the last couple of years have you really given out for these illnesses, these NCDs, critical illnesses?
Right. So persons don't, you know, people don't really discuss these things. But about 2 years ago, Sagicor had paid out over $4 billion in critical illness claims.
It costs a lot.
It costs a lot.
Costs the economy a lot.
When you really look at how much you input versus what you may have to get in a claim, it's one of the best investments you could really do, right? To allow your thousands to equate to millions if you ever had that kind of experience where you needed that money.
Dr. Soares Winters, we're almost out of time, but I really want to get this last point in. How do we join the Heart Foundation of Jamaica in terms of when we're, as we're saying, preparing for, you know, what if? How do we become a member to ensure that we get those kind of services?
Okay, Heart Foundation offers memberships to Jamaicans to come in, and the costs are $1,500 per year if you're under 65, and $1,000 for persons over 65. That provides you we get discounts on our pharmacy that we have, on our lab services that we offer. Many of our services are open to the general public to come in. We also, not just for our Heart Month activities, but we do have outreach services. So we have a mobile clinic that goes out. It can go out to companies. It goes out to various communities. Just because a big part of our work is to ensure not just educating the broader public, but trying to reach to those individuals who may not have access to come into Kingston to where our main offices are. So that's what we want to say. And I just wanted to reiterate or emphasize a lot of what was said before. A key thing to remember is that one of the risk factors, like high blood pressure, it's not something you feel. It's what they call a silent killer. And for many persons, by the time they are getting an event to happen, like a heart attack or a stroke, that's the end stage. And so what even insurance companies do emphasize is about prevention, making sure that you do get your numbers checked from early on. Don't wait for the illness to happen. And knowing that these things affect our entire population, we want to make sure that persons start screening themselves from early. So from birth, get your height and weight checked. Look at what you're eating. Start reading your food labels. Start monitoring your health. Get checked out annually. We have schools that you have to get your medicals before your children go into schools. And most companies require us to do a medical. Get an idea of what your status is. And so you can then prevent some of those things. And yes, I'm sure the insurance will tell you that you will definitely benefit from lower premiums when you're a healthier individual.
Invest in your health. Invest in insurance. You're never too young to start thinking about a healthy lifestyle and how you're going to cover yourself in terms of insurance, your family, anybody who is close to you. Ensure that they get the information. Visit the Heart Foundation of Jamaica. Check out their website to become a member. You've just watched PBCJ Presents. Thank you so much, ladies, for joining us for this really informative discussion.
Thank you for having us. Thank you.
Thank you, Dr. Soares. All right, everyone, pleasant viewing. Pleasant viewing.
Now click.